Hi, today we are going to talk about stress, anxiety, and student mental health in the college campus. Um, so, college students very often experience anxiety and depression in the higher education learning space. Uh, Most students report being overwhelmed, being stressed as they undergo their college education. Now, colleges and universities in the United States have a limited amount of mental health resources available to students. And that is what we're going to talk about today and how we can improve on that. Yeah. So, in this speech, I'm going to make an argument that the mental health institutions, the college campus, the universities have to do more. They have to provide more mental health resources for the students. Um, and this is important for both the student and both for the colleges. The students want to go to college, learn, graduate, and be better members of society. The colleges want to educate and produce a workforce that is going to serve the country. Now, mental health issues are more widespread than we think. Most people don't talk about it. There is a stigma about it. We all keep quiet, but it's happening. Just because people are not talking about it does not mean it's not happening. It is happening. Many students report having anxiety, depression in the course of the education career. Mental health issues have an impact on motivation, they impact an ability to return information. It also has a high impact on the graduation rate for colleges. Yeah. Now, if we look at the academic impact of stress, anxiety, and depression, it causes difficulty concentrating. It lowers attendance, declining grades, and increased risk of dropping out. Think about it this way. You are studying, say, mathematics. You've got problems at home, you've got difficulty paying your fees, you've got your car broke down, and things that are not even college related. Say you struggle to get to school on time, and this is causing you stress, it's causing you depression. You've got, say, a loved one passed away. That stress can impact your ability to study, to sit in class and concentrate and learn and return what you've learned and apply it in a test, in an assignment, to be able to collect enough credits to graduate. Now, when stress and depression come in between that process, it increases the risk and the likelihood of students completing their education, and it increases the dropout rate. Colleges have a limited mental health resources. They do provide some resources, but those resources are not sufficient. Colleges, there are long waiting lists. So say today I'm struggling with depression and I want to get help. I'm not going to be able to access that help immediately because there are long waiting lists. There's a lack of crisis support. There is insufficient mental health education. Now, I'm going to advocate for more mental health education, not just taking a psychology class, but in your regular math class, just your professors being equipped to be able to talk to the students about stress, anxiety, and depression. They don't have to have a master's degree in clinical counseling to be able to support their students. They need to be able to learn about stress and depression as professors to be able to support their students when the students are undergoing this anxiety. Sometimes students become overwhelmed. Sometimes this subject is just too much to learn, too much to do, and the students become overwhelmed. Now, the consequences or the negative part of stress, anxiety, and depression is that it increases the rate of burnout. It puts the students at risk of substance abuse. Now, substance abuse could lead to DUI, arrest, and dropping out of of school, and so many more issues. Obviously, these students are at a high risk of academic failure. And then this does not affect only one or two students, it has a wide, campus-wide spread impact. I'm going to recommend that colleges take action. There is a need to take action now, and colleges have the ability to take this action. They can increase the access to counseling. Colleges can hire more mental health professionals. Colleges can reduce the wait times, hire more professionals, train the professors that are not counselors. Professors who are not counselors, your math professor, your physics professor, your economics professor, need to be equipped to be able to take a low level sort of discussion of stress, anxiety, and depression with the students. Other than that, also train hire more mental health practitioners that would help alleviate this problem. Now, this is what we were talking about, teaching stress management. It doesn't have to be the highest level clinical, even low level. Your academic advisor should be equipped and be able to, academic advisors should be able to help students in this manner. Encourage students to seek help. There is a lot of stigma around mental health. Students tend to not speak about it. So encourage students to speak about what they're going through, and that will also help. Also teach students to recognize the warning signs. It's like when you're driving your car and the check engine sign comes and you ignore it. Some people ignore it because they don't know. So you need to teach students to be able to recognize those signs. Reducing the stigma. It's very important to reduce the stigma around mental health and seeking help for mental health. In conclusion, mental health challenges are serious. Colleges can play a big role in helping as far as mental health is concerned. The call to action would be hire more professionals and advocate for more funding for college campuses such as City State to get more funding so that they can help with mental health. Thank you so much.